One of my favorite things is to work with people who've had experiences where they felt unheard. I find so much joy in helping people be able to be empowered and navigate the medical system on their own terms. My name is Therese Horan. My clinic name is Sekuni, and I am a nurse practitioner and certified nurse-midwife at PeaceHealth OBGYN. I grew up in Sitka, Alaska. When I went to college, I became unintentionally pregnant. I found myself in a different state that did not have easy access to the Indian Health Service that I was used to navigating. I was alone, I was scared, and even though I was doing everything that I could for this baby that I was growing, I found myself really lost and out to sea. It felt monumental. I went into labor with my daughter, Rose, 3 months early. So I was flown on a medevac airplane while I was in labor from Sitka to Anchorage. I found out that my daughter was actually not doing very well. As the oxygen mask was on my face, I asked, "Are you doing a C-section?" Because at that point, no one had told me. And they said, "Yes." And I said, "Can you tell me why?" And I was told, "We think your daughter is dead." The next thing I know, I am waking up alone in a recovery room. I found out from one of the nurses in the recovery room that she actually was alive. And she not only survived, but she fought, and now she's 21 and thriving. In that experience, I realized that for people working in healthcare, you have to navigate some of the scariest, most vulnerable times in your patient's life. Once I was on the other side of that very emotional experience, I was left with this feeling, it can be better than this. There were many different ways that I was educated and spoke to during that process that felt like I wasn't being treated as an empowered patient.
Therese is one of my providers. I think she definitely can put herself in patients' shoes because of her experience and her backstory. She can really identify the barriers that people have in navigating healthcare. And that doesn't just apply to people with her background, it applies to all of our underserved communities.
When patients have experienced intergenerational mistrust within the medical system, it creates a culture where patients might not feel comfortable coming to us until it is too late. We feel welcome in environments where people understand our culture, understand our language. There's representation both in staff and in the art on the walls. Finding a way to utilize our limited resources in the most efficient way possible has been one of the really satisfying things about this work. We are just at the beginning of this work. There is so much that we can do, and we are at a time where this work has to be done.